Hi there. Excellent. Well, I'm sorry we're running a few minutes late this afternoon. We have also just learned that one of our guests today, Kimberly, was unable to join us due to a family um, unforeseen circumstances. But we are really looking forward to having our guest David join us, and we have Anne Single. So we still hope that this can be a really valuable session and appreciate you joining us today. Before we start, I would like to acknowledge the traditional owners of the lands on which we're meeting and working today and pay my respects to their elders past, present, and emerging. If we haven't met before, my name's Jessica Bean. I'm chairperson of Patient Voice Initiative. And today on the call we have Anne Single, who is our Patient Voice Initiative coordinator and superwoman. And I would like to extend my appreciation to the work that Anne has done in pulling this session together today. We also have our team member Cecily, who is our incredible admin support person and whose name you might recognize from your inbox. And they will be sharing with you and also monitoring the little chat. So if you have questions as we go through, feel free to please pop them in there. So I am very excited to get talking about this hub. It feels like we're a little way coming with this discussion, but since Patient Voice Initiative was formed, our work has really focused on creating tools and resources that empower and build capacity for patient communities. And importantly, we've sought to do this by listening to what patient communities want and need. The reason I personally landed in this area of work is because I experienced how difficult it was for patients to find engaging, plain language tools that gave us information that we needed to have the most impactful voice. And importantly, to just figure out how the system that had such a huge influence over our lives worked. As patients, even if we don't want to engage with the system, I think it's really important that we're able to access information to learn how decisions are made, especially when they have such a huge impact on so many parts of our lives. And so for the past 8 years, Patient Voice Initiative has been dedicated to providing patient communities information in accessible formats and building capacity in their communities so our systems can better hear our voices. Sometimes our work at Patient Voice Initiative has looked like simple shareables on places like social media, Facebook particularly, and other times it looks like deep diving and providing more comprehensive support in terms of perhaps sending patients to international conferences or doing recent research work that captures the experiences of patient communities. But we were particularly delighted last year to launch our hub, and it has been a long time in the making. It is a patient-centered online space of evergreen content in short format, plain language material that focuses on supporting patient communities to learn in a way that suits them on topics relating to HTA and having a voice in healthcare decision making. Given everything that is going on in this space at the moment, we've been running full steam ahead. Suddenly it's May, and we wanted to make some time and space to make sure that the community is finding our hub useful and to also start thinking about a shared vision for how we want to grow this space online and ensure that it is the most useful, valuable resource possible. The, I think, fabulous thing about a platform like this is the content will sit there. However, it can be added to and it can be changed and it can be really responsive to the needs of the diverse communities that we hope will be engaging with it. So the aim for today's session is to run you through what is available in the hub at the moment, see how the hub works in terms of logging on, and then speaking with some leaders in the patient community, or we've just got David here today, but David is fantastic and I'm sure will have some insights for us, and to provide feedback on his experience of using the hub, and hear about hopes and vision for further resources in this space. We do have plenty of time today, especially since we do only have one guest. So please engage, chat it, jump in the chat, raise your hand if you'd like to ask a question as we go, because we really want to hear from you on the call. By the end of the session, I really hope that you might have a better understanding of how the hub might help your community or the community that you work with, where and how to access it, and share or to start thinking about and come back to us with some feedback or suggestions for future content. So as I mentioned today, we have the wonderful David. David, have you joined us back again? Excellent, good. David was diagnosed with neuroendocrine cancer in 2018. He is passionate about ensuring every Australian patient, no matter their location, has access to early diagnosis and treatment. As part of everyday management, David found strength through Neuroendocrine Cancer Australia, and these days he facilitates the ACT support group and is an active member of the Consumer Advisory Group while undergoing various treatments himself. He's a serial commentator in the NECA private discussion group and is a Cancer Connect volunteer with Cancer Council New South Wales. David is looking forward to becoming more involved in HTA and health processes, how health processes can better support patients. David is also undergoing treatment right at the moment, so I think it's extra particularly wonderful that he's been able to find the time and energy to join us today. But before we hear from David, Anne is going to run us through the hub. And I wanted to warm everybody up with a couple of poll questions. So I think Anne is going to run the poll for us. Can we just get a bit of an indication of who on the call today has used the hub? If I'll just give everybody a moment.
Jessica, there should be 3 questions up there for everyone. Now, are you seeing those? You are great. And so there's 3 questions, just because I'm not sure whether you can see it from your screen. And one is just about, you know, why you're mainly here, what's your background, have you used the hub, and whether you've given input around HTA. Apologies that you can't see that, Jessica.
Oh, good. Perfect. So
and speakers can play along too, right, Jessica?
Absolutely.
Or guest speaker. Thank you.
Absolutely. And what I'm not seeing though yet is some results from that poll.
Yep, sure. So there are 11 out of our 16 have responded. So we always respect that some people may not want to, but just in case you haven't seen the button, it's the sort of 3 bars, vertical bars at the bottom of your tab. But I think, we just got another, so that was great. So we will end the poll in a minute. I'll just in case there's someone else who wanted to complete it.
Chris has asked on the last question, can you tick 2 answers?
Oh, that's a really good question, Chris. Now, if I've set up the poll properly, you can. So if you can experiment, we'd be very interested.
I tried and I couldn't.
Okay, sorry, Chris.
No, that's all right. I just,
Perhaps just choose the most relevant one.
I did.
Perfect.
Great. Okay, I will end the poll.
And keeping us in suspense, holding the results. Oh, okay. So we've got 58% of people have said that they haven't used the hub yet, which I think is perfect, because hopefully after today you'll understand why you might go and have a look at that resource and how to do so. And we've got a nice split across patient or consumer attendees, patient community organisations, and we've got the related area category. So hopefully after today's session, we can see a few more of you engaged with the hub. And to see why you might like to do that, I'll hand over to Anne to run you through how that's working and what's in there. I should also acknowledge that the fabulous Zali French, who has done a lot of the work on the hub and who was one of the very first people who supported and carried a huge part of getting PVI up and running, is the fabulous Zali French. And she is also joining us on this call today. So just welcoming Zali as well. And
thanks, Jessica. Great, I'll just move us along. As Jessica said earlier, and actually just before I begin, I just want to acknowledge that I'm on Yagara and Turrbal country too, so can I pay my respects to their elders past, present and emerging, and any First Nations people who are joining us online today. So this overwhelming slide is really just to touch on the fact of what Jessica referred to earlier, that over the years, Patient Voice Initiative has tried to support capacity building and awareness around getting involved in health technology assessment, the process which guides what medicines are listed on the pharmaceutical benefit scheme and what services go on Medicare, and a number of other programs the health department subsidises care in. So we've provided webinars and live Facebook, not so much live Facebook today, but live Facebook. Jessica does the podcast where we hear just amazing patient stories that really give us that patient lens of the health system. We've got videos, we've got sheets you can download and so forth. So we do have a lot of resources, but you know, they are used, but there's a sort of scenario that happens quite frequently in our lives, which is something like that's on the screen. You know, you receive a text or a message and someone says, hey, can you just put in a comment on that new medicine? Or did you remember last month we spoke about this? And you go, sure, I'm happy to help. But hey, it finishes tomorrow, or hey, it's at the end of the week. And actually you realize, and people realize, well, hang on, I don't really know what this comment is all about, or how that works, or what exactly is it they think I know that would be helpful here. And so we really wanted to respond to that. We wanted to think about time poor, and that might relate to, say, a policy officer in an organization, in organizations that have policy officers. But it also might be an individual patient or a carer who's time poor, or who is feeling in a fog, or who is not feeling great and has to get their head quickly around something that's quite important to community if you want a certain treatment to be available, but actually is kind of complex to quickly make sense of. And so that's what we were trying to start and do with the Patient Voice Hub, make it just much faster to come to terms with this topic. And that's why we call it today From Zero to Hero, because I guess we all feel in this space, you know, there is so much to know, but what are the key things to know? How can we engage quickly? And so the Patient Voice Hub was born. And as Jessica said, Zali French played a really key role. We started with this idea that we particularly wanted to reach people we hadn't reached before. We were interested in people from different backgrounds called communities, and neurodiverse people, people with intellectual disabilities, people who hadn't engaged with the usual ways of engaging. And so Zali spent an enormous time trying to connect and work out how can we do this. And so this is very much the first step in a hub that we hope belongs to the community, and that's really why we want you to be aware of it. but we also want you to let us know what you want from it, because we think it belongs to you. So a couple of things. The content comes from previous, at the moment, comes from previous work we've done in workshops and also in written form with a variety of communities. So the words and the approach and the ordering has really very much come from patient communities that we've worked with over the years. We've also worked with the Consumer Evidence and Engagement Unit, which is the part of the Department of Health that particularly deals with engagement for the Pharmaceutical Benefits Advisory Committee and the Medical Services Advisory Committee. And we're really appreciative that we send our text to them, and we really ask them to comment, is there anything inaccurate here or unhelpful? And then we work to make those improvements. And the other thing I just wanted to mention is about the illustrations. I wanted to mention Kristen Willis from Tondo Design. Those of you who know our social media tiles will recognize the people from them. We particularly wanted it to be a warm place and not a confronting place, because one of the things we're very conscious of is that when people engage to tell and share their stories and knowledge, it's a difficult job, and it often has you thinking about some of the harder stuff that you might often ignore just in order to get on and do what you need to do. And so we wanted to work on that tone a bit. So a couple of things. One of the things was that we built it on a platform provided by eTrainU. So eTrainU is a training provider, but they're up for the challenge of doing something that we don't really see as training. We see as just quickly equipping people with what they need so that they can share what they know. You'll see there is the accessibility icon over there on the left of the screen. And one of the things to note is you do have to create an account. It wasn't something we really wanted, but not something we've been able to get away from yet. And there are some advantages to the account. So you can set up your account. Obviously, it's free. And you just do that at that login area there. So say you set up your account. Let me show you quickly what's in this website. So when you come into this rather overwhelming text page, but I suggest that there's lots here that you don't need to look at. The thing that you particularly can look at is down here, this My Training button. And when you click on that, you will come through, and I'm not doing this live at the moment. I just don't have the faith in my internet connection to do it live. So I've taken screenshots. That's what you're looking at the moment. But you can go into this section, and at the moment we've got 4 topics there for you. We've got 2 more that will be up in the next couple of months. Now, the first 4 topics we focused on are just the absolute need to know if you want to give input into a health technology assessment. And we've divided them into topics that are for individual assessments. So maybe you're someone who lives with a condition, maybe you're someone who cares for someone with that condition. And then we put a separate topics for those who are in organizations. And that's because we think organizations have power to do a bit more than an individual in the space. And actually they offer something different, I would say. Like an organization may be able to bring multiple views forward, and an individual might be able to bring forward their own experience that helps illuminate those other stories. So they're both valuable. Now, if I chose to click into, say, topic 1, say I'm someone who lives with a condition and I want to give input about a medicine that the Pharmaceutical Benefits Advisory Committee is looking at on their next agenda. And those agendas are open at the moment. So consumer comments are open for the next Pharmaceutical Benefits Advisory Committee at the moment. So there'll be some of you who perhaps something on the agenda. So when you click through, you will go into a short topic. It's designed to be completed within 15 minutes. So we know it's going to take time for you then to think about what you want to give as input, but we want to just give you the basics quickly. So in that topic, we take you through checking out what's on the pharmaceutical benefits advisory agenda. So that will show you what drugs are listed there and for what indication they're considering subsidizing them for. Then you can, there's a bit of information about what sort of evidence or information does that committee already get, because usually the company who supplies the medicine has made an application, and in that application, they've provided evidence around its clinical benefits and also an economic analysis, because these organizations are looking for things that are good value for money to subsidize. And then we give you a little bit of information about, if you've got time, what other information could you find out about what this committee is looking at, but sometimes you just won't have time for that. And then we go through what sort of things do patients and carers add to these assessments, giving you a chance to think about what it is that you know that might be helpful to the assessment, guiding you through how you give that input, and then how you get feedback about what's happening in that assessment. And so to give you an example, when you're trying to think about, well, what is it they want me to share with them, we give you about 9 different examples of areas that come up quite commonly where patients have really interesting and useful insights to share. So, for example, this one is most important outcomes for you. The patient might say something like, if I could spend less time in hospital and not have so many days with pain so bad I don't know how to cope, that would be a great outcome. And so you can work your way through those, thinking about what it is that you know that might be useful to share in the assessment, and then guiding you to how you would put that through. In each of the topics, we have a little final recap. And really what we want here is for you just to leave the topic noticing what it is that you've learnt and just feeling confident to go on, that you're well equipped for what's coming next. And if, for example, you were an organisation, maybe there's a medical service, perhaps a blood test or screening diagnostic that's being put before the Medical Services Advisory Committee. We have similar information here, but we also offer something a bit more. Thinking about, you might have more than one of you in your organisation and be able to do something a bit different to what an individual patient can do. And so again, we go through the sorts of information and examples of what can be useful to submit. And we also guide you through just some ideas about how you can choose an approach to what you submit. So, for example, perhaps you want to talk to your members about their experiences, or perhaps you identify some information that's been used by a patient organisation similar to yours overseas, which you could adapt usefully for your submission. So just some ideas about how to approach it in there. Now, I hope you'll go through and explore the hub if you haven't had a chance already. I just want to show you some of these bars down the side. The ones that I find particularly interesting, apart from my training, is we've got in there a document library. And so we've got lots of extra resources in there, so you can dive deeper if you've got time or interest. And some of those resources come from other organisations. It's just the things that we think could be helpful if you want to spend more time or have more questions. And the other thing we have in there is the skills passport. Now, if you use the hub just to get ready to make a comment, you may never come back and use this. But say you use our hub again for all sorts of different things, you might like to check out the skills passport, because what you can do in the skills passport is click in there and then, oh, Anne Single's been awarded a certificate of completion. But you can go in there and there'll be PDFs of each topic that you've completed. And that might just be useful for you to show someone in a setting, or it might be something you can give us feedback on what we could do there. But just to let you know, that's in there. And my final slide, Jessica will be pleased to know, is just to let you know what we're thinking of in this space. One of the things we sort of discovered with our ambitions for this was actually before we started to think about how we connect with wider communities, we had to be really clear about what our content was, because even just going and meeting with potential people like in Train You, it's quite hard for people to understand, surprisingly, this space of health technology assessment. So in our 4 new topics, I think we've set down what sort of content it is that we want to share. We've got 2 topics in development. One's just on this thing called health technology assessment. And the other is about if you have a longer time to prepare, so not just being aware when something's on the Pharmaceutical Benefits Advisory Committee agenda, which will only give you sort of 8 weeks to prepare your comment. But if you know a couple of years out about something coming for your community, what could you do in that space? We'd love to increase the video content for people who prefer to listen and watch rather than read. And we'd love to, in Patient Voice Initiative, now update our original website so that it better complements what's in here. And with that, Jessica, I think that's my speedy rundown of the site, and I hope people will ask questions or write comments in the chat, but I will hand back to you, Jessica.
Thank you so much, Anne. That was a really great overview and highlighted a couple of features that I actually forgot were in there. I think having that library in there where you can have Anne and others who are experts in their field curate a little library for you, I think is a fantastic resource, particularly for people who are busy or have many demands on their time and energy. So to have that list already pre-prepared is such a valuable feature. Since we do have a few extra moments today, I might just make sure that if anybody has questions about what is currently in the hub or observations about what we've just gone through, that you might like to pop your hand up and have the opportunity to ask the question. So feel free to do that now if there's anything that you would like to know. Otherwise, what we will do is we'll move on to having a bit of a chat with David, who I can see has appeared back on screen. But by all means, feel free at any time to pop your questions in the chat. Otherwise, David.
Hello.
As I said earlier, thank you so much for joining us today, especially under the circumstances. I know that it's really difficult to be able to make to have the energy and the headspace to think about these kind of things when you're going through some certain treatment. So thank you so much for being here. I would love to know, why are you interested in giving input to the committees who advise government about which health interventions should be funded?
Look, so many reasons, Jessica, and I know we've got a little bit more time, so I've sort of prepared something for a little bit more time, which I might go into, and I promise to get you more examples later. But I'm passionate about navigating that better and how we can make processes better. Essentially, I'm a member of the Consumer Cancer Australia, and we come across all these things in the discussion group as well with patients. How do we get certain drugs on the PBS? How do we access certain services or blood tests, etc., on the PBS? So misdiagnosis and diagnostic tools is another one that I'm passionate about. So it's those kind of things. Seeing as we've got more time, do you mind if I just just read out a little bit about NECA, just to give people
Go ahead.
information on the organisation. If that's okay?
Yeah,
Just,
absolutely. Go ahead.
yeah, I'll read because, I don't want to forget anything, and chemophobic, etc. So NECA, and I'll start, and then we'll go into more detail later, if that's okay. Cut me off if you think I'm talking too much, because it can ramble too much, as Vicky knows. All right, so NECA, Neuroendocrine Cancer Australia, is Australia's only non-profit medical charity focused on neuroendocrine tumours, obviously. The mission of our foundation is to assist and support patients and carers through support groups and specialist nurses helpline, to lobby for access to new and appropriate investigations and treatments, and to raise awareness and knowledge of neuroendocrine cancers, which is so important because we're a little talked about cancer that not many people know about. And we talk about that. We want knowledge and awareness with the medical community, especially, but also the general public as well. So NETs are often misdiagnosed. A patient here who can vouch for that. I was misdiagnosed for 3 years. Meanwhile, the tumours grew, and for many patients, we're misdiagnosed for 5 years on average. And by that time, patients are stage 4 and often inoperable. So it's heard misdiagnosis combined with the lack of resources, support, clinical trials, and treatment available obviously creates a huge burden on the health system, but also the patient, their families, and overall the health system long term. So quick facts: there are over 27,500 patients living with the disease in Australia that have been recorded. Obviously, there are a lot more walking the streets that haven't been misdiagnosed due to lack of doctor awareness, etc. And we're working on that as well. So it's vital, as you know, Jessica, that patients have a voice and are the centre, really, of the development to ensure that it's sustainable healthcare for our societies globally, especially with NETs and other minority diseases. So equity is definitely a factor and is multi-faced, as you know. Having a diagnosis of neuroendocrine cancer in Australia, it's very clear that there is no equity or access for many patients compared to other well-known cancer groups.
Yeah, well, I might just jump in there if you like.
Jump in. I should say, pull me up, jump in, and ask questions.
No, well, I think that's the perfect lead in to ask you sort of what are the additional barriers with a cancer like a neuroendocrine cancer, where it is a lesser known or rarer type of cancer. What are some of the barriers to supporting patients to provide input or to have their experiences seen and heard, I guess?
Yeah, it's very hard. It's very hard to, sometimes we hear a lot in the discussion group, it's very hard to approach GPs about it because many GPs don't actually know about it. So many barriers, and it's just a misunderstood cancer, I guess, by so many. So these are the main barriers that we're trying to bring down with empowering patients to go to their GP. And we've created, accredited courses for medical clinicians and that sort of thing. So too many barriers to go into right now, but you get the general gist, yeah?
Yeah, absolutely. And I think that providing opportunities for patients to provide input when there is a community that does feel like their experience isn't seen and heard adequately, particularly by decision makers, is something that we believe is really important. And I think it has always been a foundation of our work. You've had a chance to have a bit of a look at our hub. Can you tell us what was useful to you and how that could help you pull out that experience? and ensure that some of those experiences are better reflected and valued in our system, and particularly in healthcare decision making.
Yeah, sure, I'd love to, but I just want to get to one more example, or a couple of more examples if I can, about neuroendocrine, like example of a diagnostic blood test and tumor marker specific to neck cancer called chromogratin A, CGA, is not funded by Medicare. This leaves our patients out of pocket anywhere from $50 and upwards, and possibly every 3 months. Another example, and I'll be quick, is our gallium dotatate PET scans, which specific again to neck cancer, diagnostic and monitoring tool that detects not only tumor growth, but also required for tumor receptors for patients to be eligible for certain important radiation treatments, such as lutate PRRT. These scans can be Medicare covered for some tumors, depending on the tumor location, but it just doesn't make sense. You know, if you've got neck cancer, we should all have this important scan covered for all. And the same for commonly used somatostatin analogs, which are commonly used for many patients. These are monthly injections that help with symptoms and help slow growth. Depends on the tumor. Some people with lung nets don't have that Medicare, that don't have that treatment covered by Medicare, and then it's up to the clinicians or the patient to submit an application for compassionate grants, etc. NETS doesn't discriminate between adults, you know, adolescents, children, men, etc. And tumors can appear anywhere in the body. So we're in a very unique position compared to other cancers regarding treatments, clinical trials, because they're all different as to where the tumors appear. And the latest campaign is a rarer side of, we have many types of NETs then apart from all that, but then we have rarer types, such as von Hippel-Lindau, VHL, I hope I've pronounced it well, which is a rare genetic form of neuroendocrine cancer in which tumors can grow in patients' brains, spines, eyes, ears, kidneys, etc. And one of the medications that is proven effective and life-saving medicine, which is available in the USA and UK and is TGA approved here, and it's considered an orphan drug classification, is not covered by Medicare. It's costing patients $12,000 per month out of pocket to survive and to function well. This is a current campaign NECA are fabulously working on, but it's these kind of things that we want to give input on, and I think this is where the hub comes into that sort of area, and we desperately want patients to be funded, especially for this new drug for VHL patients. So with that, your next question was?
Well, I think that was a really valuable background as to why it's so important that patients in your community have a voice and
it's very complex. Yeah.
And help decision makers better understand the experience of a patient in your community. I might just throw to Anne quickly, and then we'll come back to the question that we were talking about. But Anne, I'm going to go off script and ask you, I think David has illustrated so beautifully some of the things that are really misunderstood about his type of cancer. Can you tell me, as somebody who is an expert in this space, how patient knowledge, particularly with a lesser known patient experience, can help decision makers make decisions about funding access to treatment? What type of specific things are really valuable for them to know?
Yeah, so one of the things that just stands out in experiences and I think would be true, and look, it's different all the time in these assessments. But one of the things that often comes up is, what is the pathway of care? And if you come from a community where diagnosis is takes a long time and therefore is often late stage, understanding that pathway for decision makers to know your pathway to diagnosis and what that means for when you typically present is really important. Because when someone, for example, makes an application, say for a medicine, it could be a screening service, but they will have a pathway where they're going to position that treatment, and that will be what the evidence they've put in supports. And so it's really important that the decision makers know from local patients, well, what did your pathway to diagnosis look like? And what did that mean for the options you have for your care? So that it varies from one assessment to the other. And one of the other things I should say, which comes up in this, is in our hub, we provide general advice. But one of the things you'll see when you get through the hub, and which we say to people on the phone all the time, is we always think it's worth talking to the Consumer Evidence and Engagement Unit, because at the moment we can't see what evidence has been submitted for a topic, but they can, and they know where the gaps might be, and they can give you really specific advice about what works. But pathway is always important. Outcomes that matter to you are important. So if you know a clinical trial might measure just one primary outcome, and it may have some quality of life data attached to it, but what are the things that matter most to you? That's really helpful for the committee to understand as well.
Yeah, excellent. Thank you, Anne. So David, then we'll come back to the hub, and can you tell us what you think was in there that was really useful to your community or to your own experience?
Yeah. So essentially, I see the Patient Voice Hub as a one-stop shop for people like me who are still learning about HCA and the processes. And essentially, they're split into two main groups, as Anne mentioned earlier, how to provide input into the PBAC and the MCAC, so for health services, bloods and other procedures for MBAC, and MSAC, and medicines for PBAC, which I love. And then that's split again into organizations. So each module goes for about 10 minutes, which is easy. So I think it's really good to say it is 0 to hero in 15 minutes, but I'd say 10 for some patients. So it's fabulous.
Excellent.
Yeah. And yeah. Sorry. Yeah.
No, I was just going to say, I think that time constraint is so important for people, for patients, but also for those who are working within patient organizations. So although it did require a lot of cutting down information, I'm really glad that you found it short and concise, because I think that that's one thing that it can be lacking sometimes when patients are expected to go through pages and pages and pages of really heavy information. It can, that alone can be a real barrier. So it's great that that was your experience.
Yeah, and I especially like the interface, the do's and don'ts section, and also the flip cards of possible quotes to use in a submission as well. All that's so very useful. I know NECA has used it, Endocrine Cancer Australia, with the current VHL campaign. And for me personally, I use it to discuss in the consumer advisory group, but also to empower patients. One other thing, the resource centre, which I discovered last night when I did my homework, and is amazing too. So I love, for me as a picture person, I love diagrams and flowcharts and that sort of thing. So that's all there, as well as as well as everything that was covered, that's covered in the training section, you can actually print out, especially the acronyms. I mean, how many acronyms are there in this process, which is fabulous to know because you need to know them. But it's, you know, it's a 12-page document, but everything's there for you in the document library as well. Love it.
I think acronyms are one of those things that are, those who use them sort of do so easily and to the point where often we forget we're using them. I know that I'm sometimes guilty of this, but again, if you are reading a piece of information that is full of acronyms, that is also a real barrier. So I'm glad that you were able to pull that out as a helpful resource. It can't all be glowing feedback though. What do you think could have been done better in the hub?
As you know, or Anne knows, I was a tester back in early or late last year, and I think most things actually have been incorporated in the hub, which is great. I think there's always room for improvement though, but I think there's not much to improve at the moment. For me, looking at as a new person, you know, still learning about the HTA health technology assessment process, it's perfect. And it's fine from my point of view, but I think it could be a really good tool for collaboration with other support groups, health organizations to collaborate and use it as a tool like that. I don't see what could be better at the moment from my point of view. Others might have some other ideas and you might want to put it out to them.
Well, we did have a number of people who had gone through the hub when we did our poll at the start. So if people do have comments about what could have been better, please pop them in the chat, or if you don't feel comfortable doing that at the moment, please always feel free to drop us an email. Thinking forward to future content, because we do have, as we've seen today, a lot of content in progress, but also mapping out what other pieces of information are really suitable for this format. What would you like to see in the hub, David? And you've already kind of touched on a couple of things, maybe some more collaboration for content, but is there anything else that you would like to see in the hub?
As I said, look, it's a fabulous tool. I think separate to what we've talked about and providing input on medicines and procedures and that sort of thing, which is comprehensively covered already. I think other topics could be empowering patients to self-advocate, step-by-step know-how, how to do that process, and or how to approach politicians and lobby, for instance. Many patients leave that up to organisations, but as we know, it's better coming personally from a patient and their story, their point of view. And perhaps something along the lines, I know there's videos, but accessing clinical trials might be another one. Just off the top of my head. So, yeah.
No, they're actually excellent suggestions. I think clinical trials and what that looks like, particularly as an access pathway in Australia for patients who don't have other treatment options, is something that we have been asked a lot about as an organisation, and definitely something that we should consider and discuss further. I can see the lovely Monica has dropped a comment in the chat, said would be great to have a single messaging to encourage people to use the hub as a single source of information. We could all direct our communities here and not duplicate anything. Yeah, absolutely, Monica. I think duplications, when we're all working in a resource-strapped environment, I think can be, just, frustrating to see lots of organisations spending time and resources. But we want this space to be as useful as possible. So if there are specific things that organisations would like to see in there, or ways that we can shape the content so it's more relevant to a patient community, we're really open to doing that. Similarly, if there's content that exists already and could be repurposed to sit on in the hub, we're really open to that too. So if there are things that people find really valuable in terms of resources, please feel free to send them through to us as suggestions, and we're more than happy to see how that might work and what that might look like as well. We're all about collaboration at PBI and making sure that the things that are most valuable to patients are visible and as visible as they possibly can be. So that's an excellent suggestion. We can chat more about that in May, perhaps.
And Jessica, one of the things that David suggested to us, which he nicely hasn't said, hey, you guys didn't do this yet, but I thought it was a terrific suggestion, was to create a videos of people actually preparing their submission, and we know we want to get away from this written form a lot more. And so I just want to tell you, David, I'm sorry we haven't done that yet. But we very definitely want to do it, because I think how lovely would it be if you could watch a short video, see someone really engage with this process and get their submission in, so you didn't have to even read any of this. That I would love that. So really appreciate it, and really appreciate all the feedback from people. We only hear it as useful.
Absolutely. And I think as a patient myself, I can say I really always value hearing from patients when I've put submissions forward, knowing that there are other people who are doing what I'm doing and how they're doing it, and or for parts of the process that I haven't been involved in before, but want to engage with. Sort of hearing other people's experiences are really helpful. So the more ways we can do that, I think the better. So that's an excellent suggestion. Thank you. We are coming to the end of our session today. I just give everybody one last opportunity to ask any questions about the hub or sharing suggestions for content. Before I go, I would of course like to acknowledge our sponsors who make our work at Patient Voice Initiative possible. Acknowledge the time and energy that we've had a number of people put in to be able to run today's session, but also get that hub up and running. We've had a lot of input from patient communities and feedback, and of course for David's time and energy today at such a challenging time. It really is a collaborative project, and we're so pleased to be able to share more about it with you today. So thank you to our sponsors. Thank you to all the communities that have been part of this. Thank you very much, David, for your time today.
You're welcome.
And we hear from more of you about your experience using and vision for the hub. And if there are no more questions, and if I haven't forgotten anything, Anne, I'll give you one last chance to jump in with anything I might have forgotten.
We would love if you want to throw a topic in the chat, or if you want to jump on the mic and let us know any topics, any priorities you think we should be addressing. We really love to hear your feedback on this. As I say, we've got 2 topics in production. There's nothing to limit what we're doing. There's nothing to limit what topics we can start to explore there, because we think it's your hub and we want to make it useful to you. So feel free to throw anything in the chat. And also you can come to us via Facebook or any of our other sources and just give us your feedback. That's really all I was going to say. And Cecily has wonderfully put her email in there as well, so that you can reach her that way. If you're using the hub and you're experiencing any problems, do let us know as well. We understand that if you go back through training library, you can't get into content that you've already looked at. You've got to go through my training. We're working on things like that, which are just irritating when you're trying to get submissions in quickly. So do let us know if you find any of those other painful points as well.
Absolutely. And I'll just emphasize again that any and all feedback is always welcome as we're developing this. I think sometimes the experiences of people who feel like something isn't right or is challenging to use, that's the most valuable feedback, because that's what enables us to build better content and better processes and better systems. So any and all feedback, always welcome. But with that, I will say thank you so much to all of our attendees here today. Thank you to the wonderful David and Anne, Zali and Cecily for your work getting this up and running. And we hope to see a number of new completions of the units in the hub very soon. Thank you so much for your time.